Hello, 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 hello. Good evening, everybody. How is everyone doing? I hope everyone had a wonderful and enjoyable Sabbath Saturday day. And we appreciate you taking your time to join us this evening here on our Health Talk podcast. We're coming to you live. Yes, it's later than we normally come on, and it's at a different day and time that we normally come on. But we're trying to move forward with bringing you more health education and health information here on our podcast called Health Talk. Health Talk is a part of He Cares Training and Education Center, where yours truly is the program director, and Dr. Deidre Willis is our program manager. Thank you so much for taking time this evening to join us here on Health Talk. We will provide you the contact information of how to get in touch with us at He Cares Training and Education Center. We'll provide that information to you at a later time during this podcast. Again, go ahead, hit that like button if you're on Facebook, hit that share button, hit that like and share button if you are watching us on Facebook. And if you're watching us on YouTube, go ahead and hit that subscribe and that bell and notification button. I encourage you to please take a moment and share this podcast with a loved one, share this podcast with someone, because we think we got a very interesting topic that we're going to be discussing tonight. But we're asking for your help to help get our numbers up on our YouTube channel. So if you don't mind to just take a moment, go to our YouTube channel and subscribe and help us to get our numbers up. We're trying to reach a certain goal on the our YouTube channel, and we would greatly appreciate that if you could go ahead and just subscribe to our YouTube channel. Okay. All right. So let's get moving. Tonight or this evening, the topic that we're going to be discussing is one that I personally think that is a significant concern. We're going to be talking about high blood pressure. You know, with high blood pressure, there are so many people that are suffering from high blood pressure, and some of them don't even know that they have high blood pressure. So we're going to take time this evening and provide you some information and some educational things regarding high blood pressure. High blood pressure is a very prevalent thing, particularly among the African American communities. So we're just going to provide you with some brief overview, some information, some education regarding high blood pressure. And we hope that you will find this information that we're going to be presenting to you to be very beneficial as well as very educational. Okay. So, with that being said, let's get ready to go ahead and begin to start our presentation here on Health Talk. So, go ahead, tag a friend, notify a friend, let them know that He Cares Training and Education is coming forth live tonight. Yes, we're coming to you tonight here on our channel. Give me just a minute to get things set up here. And I am going to have it set up. All right. So let's get started. Tonight we're going to be talking about high blood pressure. As I said, high blood pressure is a very important topic, especially among the African American communities. So we're topic on tonight is high blood pressure. And we're discussing high blood pressure because, as our motto goes, is because your health matters. All right. Now, so first thing we're going to look at is we're going to look at our objectives. Our objectives in this presentation is we're going to actually define what hypertension or high blood pressure is. We're going to discuss some facts about hypertension. We're going to talk about types of hypertension. Then we're going to give a brief overview, as well as discussing risk factors, symptoms, treatments, prevention, complication, and some self-monitoring. We're going to talk about all of this uh, in this podcast on this evening. So, if you will, go ahead, take a quick moment, like, share, tag someone, get this information to them. I promise you, you're going to find this information to be very useful for yourself, for family, for friends, loved ones. So go ahead, like, tag, and share. And if you're watching us on our YouTube channel, please go ahead and subscribe to our YouTube channel as well. All right. So the first thing we're going to talk about, we're going to define what is actually hypertension. What is hypertension, or what is high blood pressure? Excuse me. Blood pressure itself, or BP, is the measurement pushing against the blood vessel wall. That's how you get your blood pressure reading. It is the measurement when we measure the amount of pressure or the amount of force of the blood as it's going through your blood vessels. Uh, that is how you get your blood pressure reading. Now, high blood pressure is when the force of blood pushing against your artery wall is consistently too high. That is how you get high blood pressure. Now, just keep in mind that blood pressure itself is the measurement of the pressure or force of blood pushing against the blood vessel wall. And high blood pressure is when that force pushing against your artery wall consistently is high. When that force is real high, or that is when you get into high blood pressure. Okay. Now, excuse me. Let's move on to the next slide. Let's see. There we go. Let's look at some basic facts about high blood pressure or hypertension. The words are interchangeable. So if you hear me say hypertension, I'm meaning high blood pressure. And if you hear me say high blood pressure, I'm meaning hypertension. So the words are interchangeable. Okay. So some facts to know about high blood pressure. Roughly 1.28 billion adults between the ages of 30 and 79 throughout the world have high blood pressure. That is a very, very high number. 1.28 billion adults 30 to 79 years old have high blood pressure. And two-thirds of these individuals live in low to middle income communities or countries. Now, about 46% of adults with high blood pressure are unaware that they have this condition. Again, that is a high number of individuals that are suffering with high blood pressure and do not even know they have high blood pressure. Now, less than 50%, or roughly around 42% of adults with high blood pressure are diagnosed and treated. So less than half of those individuals that have high blood pressure are actually being treated with high blood pressure and have a diagnosis of high blood pressure. Now, about 1 in 5 adults, which is roughly 21% with high blood pressure have it under control. One out of every five adults actually have their high blood pressure under control. We need to get those numbers up. So that's why we're here providing you with some education and some information on it. Okay. Now, high blood pressure is a major cause of premature death throughout the world. This is sad. It is the major cause. High blood pressure, a condition that can be treated and can be managed. But high blood pressure is the major cause of premature death throughout the world. That is something we need to stop and think about. A condition that is basically can be treated as well as managed, and it is the major reason for premature death throughout the entire world. We got to do something about that. All right. It says one of the global target of the World Health Organization, one of their goals and one of their target is to decrease the prevalence of high blood pressure by 33% between 2010 and 2030. Okay? So, we have a job to do. We, as healthcare professionals, have a job to do, and you, as the consumer of healthcare, you too have a job that you must do. And collaboratively, we can get this thing where we can have high blood pressure to bring those numbers down. So that's why we're here to provide you with some information and some education regarding high blood pressure so that we can keep on getting those numbers down. Okay. All right. Our next slide is we're going to talk about the two types of high blood pressure. There are basically two types of high blood pressure. The first type of high blood pressure is called primary hypertension. Now, you may also hear it termed as essential hypertension. Now, primary or essential hypertension, this is the most common type of high blood pressure. This is the most one that people get diagnosed with. You see your provider write essential hypertension. This is the most common type of high blood pressure. Now, with this particular blood pressure, it gradually develops over time. And as we get older, and it is greatly influenced by things such as lifestyle and diet. There's something to think about there. Essential hypertension, which is the most common type of high blood pressure, that develop gradually over time as we get older, and it is greatly influenced. It is greatly influenced by two things: lifestyle and diet. Okay, so we got to work to get this high blood pressure numbers down, and we can do it. Now, the second type of high blood pressure is called secondary hypertension or secondary high blood pressure. Now, with secondary high blood pressure, the underlying cause for this type of high blood pressure is by some type of another type of medical condition, sleep apnea, uh, kidney issues, thyroid issues, um, tumors on the adrenal gland that sits on top of your kidney. Um, these types of condition may cause secondary hypertension, as well as certain medication, over the counter uh, pain medication, over the counter cough remedies, and things of that nature. Even some prescription medication may cause secondary hypertension. And with this particular high blood pressure, it has a tendency to be even higher than in primary hypertension or essential hypertension. So there's some work that we've got to do to just get blood pressure under control and better managed. And that is what we're here for, to provide you some tools to make an informed decision on getting your blood pressure better managed and under better control. All right. Now, high blood pressure or hypertension is when your top number is 140 or higher and your bottom number is 90 or higher. We're getting into hypertension. And if you would notice on the chart that we have on the screen there, there are certain categories of blood pressure. Now, these categories are listed here. As you can see, a normal blood pressure. A normal blood pressure is when your top number is 120 or less and your bottom number is 80 or less. If you're within those range, then you have a very normal, what's considered a normal blood pressure. Again, a normal blood pressure reading is when that top number is 120 or less and that bottom number is 80 or less. Now, when we get into the range between above 120 up to 120 to 129 on that top number, or the bottom number um, is over 80, you're starting to get in what's called elevated blood pressure reading. This is when you want to start really paying close attention to your blood pressure, monitoring your blood pressure a little closer. Now, when we get into what's called hypertension stage 1, that's when that top number begins to get over 130 and that bottom number begins to go over 80. When we start getting to those range, we're starting to getting into stage 1 of hypertension. Then we move down to stage 2 of hypertension, and that is when that top number starts to be in the 140 or higher, and that bottom number gets into be 90 or higher. Now we're really starting to get into stage 2 hypertension. Now we're starting to get into some very critical zones with our blood pressure that we need to really, really, really start paying close attention. And we really need to start making some serious decision about making some changes and getting our blood pressure reading under control. Now, there is such a thing that is called hypertensive crisis. And when we're in hypertension crisis, we need to seek immediate medical attention. Do not wait around. And that is when your blood pressure reading is over 180 on the top number and over 120 on the bottom number. You're in what's considered hypertensive crisis, and you need to seek immediate medical attention because it could lead to some other serious um, health condition, and we want to try to prevent that at every cost. That's why it's so critical that we keep our blood pressure managed. Okay. All right, we're going to move on to our next slide. And some of you may have heard, when they got to the hospital, they were in hypertensive crisis. That means their blood pressure was very, very extremely high. All right, now blood pressures are written in two numbers and is separated by a slash, as you can see on the screen there. 120 over 80, and that mmHg is millimeter of mercury. That is how you hear the blood pressure reading. You might hear them say your blood pressure is 120 over 80. And when they say 120 over 80, they mean 120 over 80 millimeters of mercury. We don't typically say millimeters of mercury. We just say your blood pressure is 120 over 80. And again, going back to the previous slide, it shows that 120 over 80 is normal. So if you're in that range, you're in good business. You're in normal. Let's try to keep it maintained at that normal range. Now, the first number or the top number is called your systolic pressure. Now, that's the force of blood. That's the force of the blood when the blood is pumped out of the heart. So when the blood is pumped out of your heart to be distributed to the rest of your body, that gives you your top reading of your blood pressure. If that number is high, that indicates that that blood is having a hard time trying to pump out of your heart to get to the rest of your body, which in turn will cause that top number, your systolic number, to be elevated, meaning that your heart is having a hard time pumping that blood out. The second number, which is called your diastolic number, that is when the between heartbeats, when the heart is filling up with blood to be pumped back out again. Now, if that number is elevated, then that means that blood is having a hard time trying to pump back to fill up in your heart to be pumped out to the rest of your body. And this is how you get your blood pressure reading. Again, the systolic number, that's the top number. That is when your blood is being pumped out of the heart to be distributed to throughout your whole body. And your bottom number, which is the diastolic, is when heart beats when the heart is filling back up with blood. And if the top number is elevated, blood is having a hard time getting out. And if blood is having a hard time getting out of your heart to the rest of your body, that means certain parts of your body are not getting adequate oxygenation, are not getting adequate blood supply. And if your heart is having a hard time filling back up, then that means you can't get a good oxygenated blood throughout through your body. So now we're starting to create some other issues throughout our body. Okay. So it's critical that we watch our blood pressure and get it under control. Now, your blood pressure does change throughout the day based on your activities. Okay, so you might take your blood pressure in the morning and it be one reading. That's because you're just waking up from rest. So you're not really active or you're not really doing anything. As opposed to you taking your blood pressure later in the day when you done been up, you done been out running, doing errands, doing various activities and everything. So you will get a variation in your blood pressure reading throughout the course of the days based upon the activities that you're doing. Now, as we all stated in previously, a healthy systolic blood pressure or top number of your blood pressure reading is 120 or less. Okay. A healthy diastolic or the bottom number of your blood pressure reading is 80 or less. So if you're in that range, you have a healthy, what we consider a healthy or normal blood pressure reading, and that is good. Okay. Now, your blood pressure is high or considered to be hypertension when you have consistent systolic or top number reading 130 or higher and a consistent diastolic or bottom number reading 80 or higher consistently. So if you check your blood pressure 7 days a week, and during those 7 days a week, your blood pressure has consistently been 130 or higher on the top and 80 or higher on the bottom, you consider to have high blood pressure. Okay, and that's why it's important to closely monitor your blood pressure. All right, we're going to talk a little more. Let's move on. I hope everyone is finding this to be beneficial and education to you. We want to take a moment right here to say to you, you that are watching on YouTube, please, 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 we're asking that you like, leave your comments, subscribe on our YouTube page, like and share on Facebook. Please, we're asking you to go to our YouTube channel, uh, Health Talk YouTube channel. Please go to there and subscribe there. We really need your help in getting those numbers up on our YouTube page. Also, if you're watching, you can go ahead. If you're watching by YouTube, you're watching by Twitch, you're watching by Rumble, you're watching by Facebook. If you have any comments you want to make, you can feel free to type those comments, and we'll be able to see them and answer any questions that you may have. All right, moving right along. The symptoms from high blood pressure, the symptoms that you get from high blood pressure typically do not occur until an individual is beginning to have serious health issue. So what am I saying? Sometimes you can have high blood pressure. As we said in a previous couple of slides, you can have high blood pressure and not even know you have high blood pressure. You will be what we call asymptomatic, meaning that you don't have any symptoms at all. You could be feeling fine, everything is going fine, you're just going about your day, doing your daily activities, nothing happened, you don't feel sick, you don't feel no kind of symptoms whatsoever, but yet you could be have high blood pressure. Yeah, that's the scary part. That's the dangerous part. Because I want you to remember what I said, that your systolic number is when blood is being pumped out of your heart to get to the rest of your body. Remember, if that blood is struggling to get out of your heart to pump through the rest of your body, those body parts that are not getting that oxygenated blood or getting proper blood supply, it begins to create issues or complications behind the scenes that we don't see right away. The same thing goes with when the blood is trying to fill back up in your heart to be pumped back up. So that's why it's very, very critical, very crucial that we get our blood pressure under control. Because as it says here, you don't begin to see the symptoms. You don't begin to have those symptoms. And we're going to talk about some symptoms here in just a few minutes. You don't begin to notice them until you begin to start having some serious health issues. Okay? Nearly one out of every three adults in the United States with high blood pressure don't even know they have blood pressure and are not receiving any type of treatment. One out of every three adults suffer from high blood pressure, not even knowing that they have high blood pressure, and they're not even receiving any type of treatment. That's something to think about, something to really, really consider. Okay, monitoring one's blood pressure at home regularly and with routine doctor visit is recommended, and it's a very good practice to do. So if you don't have a way of monitoring or checking your blood pressure at home, go to these places like Walmart or Walgreens, CVS, and get your blood pressure. Just get it checked and start recording. If those numbers, remember, if it's being consistently 130 on the top or higher, or 80 and higher on the bottom, you might want to have that discussion with your primary care provider, your health care provider, whomever it may be. You might want to have that discussion with them. Okay? Because remember, one out of every three adult has high blood pressure and don't even know it and are not receiving any type of treatment. Okay? And if you saw our a previous podcast, we talked about preventative screening. Uh, let's catch it in it before it get too far down the line and start creating some other problems with our health. Let's catch it before it get too far gone. Remember, it's easier to control something when it's here as opposed to trying to control it when it's out here. Okay? Keep that in mind. I can control and manage it better when it's right here as opposed to me trying to control and management when it done got like this. All right. Now we're going to talk about some modifiable risk factors. And what does that mean? These are risk factors that you as an individual, you can control, that you have control over when it comes to high blood pressure. They're called modifiable risk factor, meaning that I can modify them, meaning that I can change them, meaning that I can alter them. Okay, modifiable. I can modify them, I can change them. These are something that I can have control over. These are things that's something that I can manage. Okay, and number one is an unhealthy diet. We have control over what we eat. So I can manage my diet. This is a modifiable risk factor. This is something that I have control over. I choose to eat healthy or I choose to eat unhealthy. Mhm. Being physically inactive. I choose not to do any type of activity. I choose to just sit around and not do anything. This is a modifiable risk factor. All of these things that I'm talking about are risk factor for developing high blood pressure, but these are risk factors that you as an individual, you as a person, you can control, you can manage, you can do something about. These these are things that you have control over. Consumption of tobacco or alcohol. If you are a smoker and you desire to quit smoking, have that conversation with your healthcare provider. Have that discussion with your provider about smoking cessation. Just have that conversation. Being overweight or obese, losing 5 to 10 pounds will make a difference in your blood pressure reading. So if you're overweight, if you're obese, then again, have that discussion with your healthcare provider about weight management, okay? Again, I say losing 5 to 10 pounds makes a difference in your blood pressure reading. And you want to watch the amount of caffeine that you take in. Caffeine has a tendency to make your blood pressure go very high. Even if you don't have high blood pressure, if you consume caffeine, caffeine will make your blood pressure spike. It is unknown why and why it does, but it does. Okay? So you want to watch those energy drinks. You want to watch how much coffee you're drinking. It is recommended that you only have 2 cups, the regular cups of coffee a day. You know, some people drink coffee throughout the day, all day long. They drink coffee and they have high blood pressure and they wonder why is my blood pressure is not being managed right because of my caffeine intake. And not only am I drinking caffeine from coffee, I'm getting caffeine from there's certain tea that have a large amount of caffeine. I'm drinking sodas. Sodas have a significant amount of caffeine, whether it's regular or whether it's diet. Even those energy drinks, they're loaded with caffeine. And there's some people that drink energy drinks 3 and 4, 5, 6 cans a day. All those are loaded with caffeine. And this is one of the reasons why, if you have high blood pressure, I can't get my blood pressure under control because of this excess amount of caffeine that I'm taking in. Be careful with your chocolate bars, certain ice creams, especially if they have coffee or caffeine as their ingredients. Watch that caffeine intake to get your numbers under control, okay? Again, these things are modifiable risk factors. These are things that you as an individual, you as a person, that you can change, that you can alter in order to help get your blood pressure more manageable and more treatable. Eating a healthy, getting rid of that unhealthy diet, becoming physically active, uh, these are modifiable things that you can actually change. These are things that you as a human being can change. Now, we talked about modifiable risk factors, meaning those risk factors that we can control or that we can change or that we can alter. Now we're going to talk about those risk factors that are non-modifiable. These are risk factors that you can't change, I can't change, your healthcare provider can't change, can't nobody change. These are things that cannot be altered. They cannot be changed. And that is if you have a family history of hypertension. So if there's someone in your family, your mother, your father, your grandmother, your granddaddy, if you have a family history of high blood pressure, it's non-modifiable. There's nothing you can do uh, to change that. Okay, you got that genetic makeup, and even with that, if you do those other modifiable things, the things that we can change, such as changing your eating habit, cutting back on the caffeine, and all that thing there are some things that are just um, in your genetics that can't be changed. There's that genetic factor that can't be altered, that can't be changed. So if you have a family history, that can't be modified. If you're 65 or older, you can't modify your age. You can't change your age. You know, we can say in our with our mouth and think in our mind that we're not at that age group or older, but age 65 or older, you can't modify that. You can't change that. You can't change if you got a coexisting disease, if you got diabetes, if you got kidney disease. These are non-modifiable risks. You can't change them. We just have to learn to manage it much better. Okay. All right. I do hope that you're getting something or this is being very beneficial to you. This information that we're presenting to you tonight. Again, if you're watching us by Facebook, Twitch, LinkedIn, go ahead and share, like, and share this here podcast, if you will, please. If you're watching us by YouTube, please hit the subscribe and the bell and notification button. Please get this video, this podcast. Let's get it out. Let's get this information. I think personally that this is some valuable information that could be very useful to our entire community, to all of you that are listening, that are watching. Please take a moment and share, tag, like, subscribe, all that good stuff. Go ahead and do that for us, please. We very much appreciate it. Myself and Dr. Willis, we greatly appreciate if you do that for us. All right, let's keep moving on. Now we're going to talk about some symptoms that are associated with high blood pressure. Now, remember we said earlier that with high blood pressure, a lot of times it doesn't have any symptoms. So you won't even know that you have high blood pressure, okay? Like I say, usually there are no symptoms with high blood pressure. And it's for this reason that it is called a silent killer. Something to really sink your teeth into and let that sit in. Let that marinate in your mind. Take a moment and reflect on that. That a lot of times, 99% of time, there are no symptoms associated with high blood pressure. And it's because of that, it is called a silent killer. That is something to really stop and reflect on. That's something to really stop and think about. Silent killer. Just listen at the word silent killer. Think about that. You know, most time, if you think about a gun that has a silencer on it, what it means is that when it shoots, or when an individual uses the gun to shoot someone, that the noise that guns typically make when when they're fired, with the silencer on it, it doesn't make that noise, but yet the bullet still perceived out of the barrel, shoots the target and kill it. High blood pressure is a silent killer. It's a killer that has a silencer on it. Why? Because it doesn't have the symptoms associated with it all the time. Now, we're going to talk a little bit later on here in a few minutes about some of those symptoms that are associated with high blood pressure. But those symptoms that we're going to talk about, typically 9 times out of 10, that a health condition has already occurred that have started doing some damaging. Okay. I really want you to really think about that for a moment. The symptoms that I'm going to discuss in a few minutes are symptoms that have the condition has gotten so worse to now it's producing these things. But whereas if we had been keeping a close eye on our blood pressure reading, if we've been monitoring our blood pressure closely, then we could possibly prevent some of these other serious symptoms or condition that we're going to talk about here shortly. I cannot stress enough to you my listening audience, how critical and how important it is about managing and controlling our blood pressure. It is a silent killer. You could have blood pressure for years, years, and not even know it. But all behind the scene, it was causing damage that we couldn't see in the beginning. Let's think of it this way. Think of it as think of it as like termites. Termites could be doing damages to your home, could be doing damage to your home for years. But you don't know that they're doing that damage until it destroys the foundation. So it is with high blood pressure. That's why it's called a silent killer. Your blood pressure could be elevated for so many years, and because you didn't feel any symptoms, because you felt good, you felt like wasn't nothing wrong. I feel good, I feel healthy, I feel fine. But all the while your blood pressure was elevated and it was doing damage behind the scene that you didn't even know it was doing until it's too late. Hence the term why it is called a silent killer. So it's crucial to make sure you manage and get your blood pressure under control and all that thing, okay? All right. As you say, I'm passionate about it. Yes, I am. Now, some of those symptoms that are associated with high blood pressure. Now, remember what I just said in the previous slide, that high blood pressure is called a silent killer because you could have blood pressure for years, could have had it for many, many, many years, not even knowing it. And when these particular symptoms that I'm about to discuss, or that you're looking at on the screen right now, or that I'm about to discuss with you, when these symptoms begin to manifest, that means that your blood pressure has been elevated so long to now it's starting to create and starting to cause other health issues that could have been preventable if we had just kept an eye and monitoring our blood pressure. Like I say, you don't have a blood pressure cuff at home to regularly monitor your blood pressure. Go to Walmart, go to CVS, go to any of these places that have a free blood pressure reading, and keep an eye on your blood pressure and start writing them down. And if that top number of your blood pressure is being 130 or higher and the bottom numbers being 80 or higher, you might want to sit down and have a discussion with your healthcare provider. Okay? Now, these symptoms that I'm about to discuss with you, about to go over with you, these is when the blood pressure has been elevated or been high for so long to now it's starting to create these here issues, such as severe headaches, chest pain, dizziness, difficult speaking or difficult breathing, nausea, vomiting, blurred vision, or any other type of changes in your vision, anxiety, confusion, buzzing in your ear, nosebleed, abnormal heart rhythm. All these symptoms is when your blood pressure has gotten so elevated. Now it's caused the body to start responding, the body to start reacting. Thank you, Sister Turner. God bless. And remember what I said back in the beginning, that the top number of your blood pressure represents when blood is trying to exit the heart to be pumped throughout the rest of your body. So if blood is having a hard time trying to get out of your body to get to your blood system to provide you some oxygenated blood, think about it. If I can't get blood supplied to my head, then I'm going to start having these chest pain. I'm going to start getting dizzy. I'm going to start getting lightheaded. If I can't get proper blood supply to my eyes, my vision is going to start to being disturbed, if I can't get oxygen to my brain, a good enough oxygenated blood to my brain, I'm gonna start having confusion. I can't think clearly. I can't think straight. You see what I'm saying? Nosebleed. My blood pressure is it's so high. Remember, the blood, the bottom number is when the blood is trying to get back into your heart to get pumped back. If it's not being able to get into your heart, it's backing up. So as it's backing up, those little fine capillaries and fine arteries within your body, such as your nasal passage, your brain, all these now blood is starting to back up in them. See how serious it is? Abnormal heart rhythm. Remember, blood is trying to get in, blood is trying to get out. And if blood is having a hard time trying to get in and out, it throws your heart rate in an abnormal beat. And you start getting palpitation. As the palpitation comes, you start to get chest pain, you start to get nausea. You see, all because our blood pressure is elevated, uncontrolled, untreated, unmanaged. Now I'm having all these other health issues simply because my blood pressure is not being controlled. I hope this is beneficial information from you all, for you all. And again, I want to take a moment, if you don't mind, hit that like and share button. I'm sure somebody can use this information. And if you're watching us on YouTube, please go ahead and hit that subscribe button. We want to get our numbers up on our YouTube channel, okay? All right. So we talked about the symptoms. Now let's talk about what we can do to treat or to manage our blood pressure. Eating a healthy, low salt diet. Getting rid of those fried food all the time. Watching your salt intake. The CDC recommends that a daily intake of sodium for all human beings should be about 2,300 milligrams. And what that equals to is about a teaspoon of salt a day. But on an average, humans between the age of 3 years old and older in America consume about 3,400 milligrams of sodium a day. That's almost doubled. Almost doubled. And then there are some groups of individuals who should less their sodium intake to about 1,500 milligrams a day. And that is anybody that is an African American, anyone that's 51 years or older, anyone that has a diagnosis of diabetes, anyone that already is diagnosed with high blood pressure. Okay? Also, losing weight. As I mentioned earlier, losing 5 to 10 pounds makes a difference in your blood pressure reading. Being physically active. And when I say being physically active, I don't mean getting out here lifting weights and all that there. Brisk walking, swimming, riding a bicycle, ballroom dancing, playing tennis, the double match. All these are what we call moderate level of physical activity. And also quitting tobacco and cutting back on alcohol consumption. Okay. All right. These are some treatment. These are some things that we can do uh, to help. Some additional treatment is medication. Now, I have listed here some common blood pressure medications. The most common ones that are prescribed to individuals that have high blood pressure. The first one is called your ACE inhibitors, and these are medications such as enalapril and lisinopril. Notice they all end in pril, so they're easy to recognize. These are what we call ACE inhibitors, and how they work is they relax the blood vessel and help prevent kidney damage. Remember, when the blood is having a hard time trying to pump through those vessels, that causes our numbers to rise, our blood pressure numbers to rise. So what these ACE inhibitor does, they relax those blood vessels to try to help the blood to flow through there a whole lot easier, which in turn should help lower your blood pressure. The second one is what they call angiotensin 2 receptor blockers, or ARBs. And these include medications such as losartan or temlosartan. Again, they too helps with relaxing the blood vessel to try and help that blood to flow through there a whole lot easier, and in turn to help lower your blood pressure. This is how these medications work. Another one is called the calcium channel blocker. These include medications such as amlodipine and phenylodipine. Again, they help relax those blood vessels. Remember, I said when those blood vessels become, so constricted that the blood is really having a hard time pumping through there. As a result, your blood pressure go up. So how these medicine help to treat your blood pressure? They help relax those blood vessels so that the blood can flow easier through there, which in turn should try to help lower your blood pressure readings. Another common one they can use is diuretics. This includes medications such as hydrochlorothiazide, or HCTZ, or clothianidone. These helps with eliminating extra water from the body. When you start to have retain fluid or water within the body, because it's putting extra pressures on those vessels, it causes the blood pressure to go up. The extra fluid causes the blood pressure to elevate. And with these particular medications, it's to help eliminate that extra fluid, which in turn should help to lower your blood pressure down. All right, moving along. And our next slide, please. Okay. All right, prevention. What are some things that I could do to help prevent or to help manage my blood pressure? If I already have it, how can I manage it? And if I don't, how can I help prevent? Now, again, remember there are some non-modifiable risk factors that no matter what, you can't change it. Okay, so some things you can do is eat more fruits and vegetables. I know, yeah, eat more fruits and vegetables. Become more physically active. Remember, I just talked about those moderate level of physical activities like walking and running and swimming and dancing. These are also what we call moderate level of physical activities. Losing weight. Again, I said losing 5 to 10 pounds will make a huge difference. Uh, if you already have high blood pressure, take your medication as prescribed and don't take anybody else's medication too, okay? If you run out. Um, Keep your appointment with your healthcare professional. Make sure you are keeping a record of your blood pressure reading and take those readings to every appointment you have with your healthcare provider. Keep the record, take those records with you. These are some things that you can do to help prevent and help manage your blood pressure. Now, on the other flip side of that thing, here's some things uh, things not to do. These are some things that you shouldn't do. You shouldn't eat too much salty foods. Cold cuts. You should watch your cold cuts. Salted snacks such as pretzels and peanuts. Uh, Processed food. You want to be careful with that. TV dinners. You want to be careful. All those have a lot of salt and sodium in it. Eating foods that are high in saturated and trans fat, all those fried, greasy food, things like that. Nate, you want to try to stay away from those things if you got high blood pressure. Eat more baked, broiled, grilled type of food. Um, if you use tobacco product, you want to stop using tobacco. You want to stop smoking. You want to stop dipping snuff. You want to stop vaping. All those things. If you drink, you want to cut back on your drinking, or you want to eliminate your drinking altogether. But if you must drink, it is recommended per day, one drink per day for women, and two drink per day for men. You don't want to miss taking your medication or sharing medication. If you happen to miss a dose, don't double dose. Don't do that. Don't double. If you miss the day or miss the time, take your medicine. Don't go back and say, "Oh, I missed it, so I'm gonna take another one to make up." You just missed it. Just count that as a miss. Don't double dose because you could bring your blood pressure down too low and you can cause hypotension. And you don't want to, if your blood pressure numbers are looking good and you're on blood pressure medicine, that doesn't mean stop taking your blood pressure medicine, please. What that means is the blood pressure medication is doing its job along with those lifestyle changes that you've made. So all of them in combination working together are keeping your blood pressure managed. Because if there are certain medications that if you just cold turkey stop taking those blood pressure medication, they could cause what's called rebound hypertension, and your blood pressure will be even higher than it was before you even start taking the blood pressure medicine. So don't just abruptly stop taking your medication because your blood pressure readings are good. No, please have that discussion with your healthcare provider. Okay, because your blood pressure, as I said, blood pressure medication, along with eating a good, healthy diet, exercising, losing that weight, they're all helping to help maintain and regulate your blood pressure. But don't just stop the medication because your numbers look good. Have a discussion with your healthcare provider. He may need to cut back on the dosage slowly. Okay. All right. And you want to reduce or eliminate or manage any type of stress in your life. Stress in your life will cause your blood vessels to constrict. And when they constrict, the blood is having a hard time pumping. As a result, your blood pressure go up. Okay. I hope you're finding this information very useful and very beneficial to you. Please take a moment, like, tag, and share this information with somebody. If you're on our Twitch page, uh, uh, Rumble. If you're watching by there, if you're watching on YouTube, if you're watching on Facebook, please, please like, tag, share. Go to our YouTube channel, please, and hit subscribe on our YouTube channel. Please, please go to YouTube. Go to YouTube channel, our Health Talk YouTube channel, and subscribe. Please do that for me. I really, really appreciate it. All right. Now, some complication associated with having high blood pressure, aneurysm. Remember, I said earlier that it's the blood is trying to pump out of your heart. If it's having a hard time, it causes that top number to go up. And if blood is having a hard time filling the heart to get pumped out, it's having a hard time getting into the heart. Blood is starting to back up. You have tiny blood vessels, blood you have capillary blood vessels, veins, arteries, and when that blood is starting to back up, we're creating aneurysm. Also complicated with having high blood pressure so long, we could have a stroke or a TIA, which is a mini stroke. That's what some folks call it, mini stroke, but it's called a transit ischemia attack. That's because proper blood supply is not getting there, or you can have a hemorrhagic, meaning that there's bleeding, meaning that the blood pressure has been so elevated till it's caused those small little capillary veins and capillary arteries to erupt, and you're bleeding on the brain, and you won't even know it sometimes until it's too late. You can have a hemorrhagic stroke, okay, and then you can have a non-hemorrhagic stroke. All right. It could cause chronic kidney disease because blood is filtered through our kidneys. And if the blood is having a hard time trying to get in or out of our heart, it can't get through our kidneys to be filtered and cause the problem with the kidney. Cause eye damage. Again, we talk about those little small capillaries, those little vessels behind the eye being ruptured and being damaged. A heart attack. Remember, when the blood pressure is high, it's either having a hard time getting blood out, having a hard time getting blood in. As a result, heart attack, or what we call heart failure, congestive heart failure. It also called arteriosclerosis, plaque building up in your arteries. And if plaque builds up in your arteries, and remember, Blood pressure is the force when the blood is, forcing against those artery walls. And if those artery walls are plaque and full up with plaque, then your blood pressure is going to go up because the blood can't flow. And vascular dementia, and vascular dementia is when you the brain is being deprived of oxygen, or if it's suffered any type of damage, such as from a stroke or things of that nature. So these are some complications from having high blood pressure. That's why it is so, so, so crucial that we get our blood pressure managed and under control. And like I say, remember, it is a silent killer. You could be suffering for high blood pressure for many, many years and not even know it. That's why I'm encouraging you. Check your blood pressure. Maybe you're not on any blood pressure medicine. Great, wonderful. Still, at least once a week, check your blood pressure. See what it looks like. And if that top number is consistently being 130 or higher, and that bottom number is consistently being 80 or higher, have that discussion with your healthcare provider. Let's catch it in time. As I always say, you can manage it when it's right here. But when it gets here, it's harder to bring it back in. Okay? Please do that for me because your health matters. It does. It matters to us. All right, some little self tip on self monitoring. If you're on blood pressure medicine or if you're not on blood pressure medicine, but particularly if you are on blood pressure medicine, your healthcare provider may ask you to monitor your blood pressure at home. It is important. It is very important that you monitor your blood pressure at home based on the recommendation from your healthcare provider. Okay? If you have been advised to monitor your blood pressure at home, here are some things that you should be doing in order to get a more accurate reading of your home blood pressure reading. Number one, you don't want to be doing any type of exercise or drinking any type of caffeine or smoking at least 30 minutes before you get ready to take your blood pressure. You don't want to do that. No exercising, no caffeine intake, no cigarette smoking, at least 30 minutes before you get ready to check your blood pressure. Because remember, I said that your blood pressure, it changes throughout the day based on your activities. And remember, we talked about caffeine automatically increasing your blood pressure reading, whether you have high blood pressure or not. It does increase your blood pressure. All right, you want to make sure you empty your bladder before taking your blood pressure. This is an experiment I did. My bladder was full. I had my blood pressure checked. It was elevated. When it emptied my bladder, came back and waited a few minutes, rechecked my blood pressure, and it was a significant difference. So yes, make sure you empty your bladder. Go to the bathroom before you check your blood pressure. Uh, if you have been outside or in the house doing some type of activity or anything, you want to wait, sit down and wait and relax about 5 minutes before you actually take your blood pressure. Okay. Excuse me. You want to make sure your legs are not crossed and you make sure your feet are flat on the floor, not dangling from the chair or dangling from the edge of the bed, but you want your feet flat on the floor and you want to make sure your legs are uncrossed. You don't want to be doing any talking, any laughing, any gum chewing. Don't want to do any of those things while you're having your blood pressure checked. You want to be just as relaxed as you can when you're taking your blood pressure reading. You want to make sure that the blood pressure cuff is not taking over your clothing. You actually want the blood pressure cuff to rest against your bare skin. It does make a difference in your blood pressure reading because remember, if you're trying to go through your clothing, that could obscure the reading. You want to make sure the cuff is on your bare skin and not taken through your clothing. Okay. And you want to make sure that the cuff is nice and snug, but not too tight. Because remember, if you get it too tight, you're going to be constricting those arteries and those veins in there, which is going to make your blood pressure elevated. You want it snug, not too tight, and you want it on your bare skin and not through your clothing. All right. And you want to make sure you're resting at a table, having your arm rested on the table at heart length. These are some tips on how to go ahead and take your blood pressure at home. Even in your provider's office, when you go to the doctor's office, you want to make sure that your blood pressure is taken that way as well. All right. Thank you so much for joining us here tonight on Health Talk. We do hope that you have found this information to be beneficial and informative. And if you will, again, I'm asking, please, ma'am, please, sir, if you would go ahead, like, tag, share, and also go to our Health Talk YouTube channel and please hit that subscribe button on our YouTube channel so that we can get those numbers up. Um, at the bottom of your screen, it should be scrolling on how to get onto our YouTube channel. We really, really, really could use your help in getting those numbers up on our YouTube channel. So if you will, please go to our YouTube channel, hit that subscribe button, hit that like button, hit that bell so you can get notification when we do go live. Um, I really would appreciate your help, and Dr. Willis would really appreciate your help as well. As I said, He Cares Training and Education Health Talk is a part of He Cares Training and Education Center. Our contact information on how to get in touch with us, our mailing address, our email address, and our telephone number is on the screen at this time. That is how you can get in touch with us. Excuse me. Um, it is on the screen at this time in how that you might get in touch with us. He Cares Training Education Center, where we provide health education and health information on various health topics and health uh, issues. All right. Again, thank you, thank you, thank you, thank you so much for taking your time to review this podcast with us. You that might be watching this podcast a little bit later on, I ask that you please go to our YouTube channel, hit the subscribe, the like, and the notification bell so that you get notification that when we go live, you that are watching us on Twitch, you that are watching us on LinkedIn, you that are watching us on Facebook, please hit the like, share. Let's get this information out. I personally feel that this has been some very, very valuable information that we could use to make a difference in our health. And as we always say here at He Cares Training and Education Center, because your health matter is why we do this. All right. I hope that you've had a wonderful experience and that you would take this information, that you would find it valuable, informative, and educational, and that you would take this information and please tag somebody. Tag somebody that you know that has high blood pressure. Even if they don't have high blood pressure, tag somebody. Share this here. Share this information. Let's get this information out so that we as a whole can become more healthier. And a healthier you is a happier you because your health matters. God bless you. Thank you so much for tuning in here on Health Talk. On behalf of myself and Dr. Willis, we thank you for joining us. Until we meet again, God bless you. Stay healthy. Why? Because your health matters. God bless. See you soon.